ABC 13 News to Go, brought to you by Danville Toyota.
Right now, there are thousands of people with the same symptoms: unexplained aches and pains, low-grade fever, fatigue, and they don't know what's wrong with them.
Their doctors don't know either. It may be one of the most misdiagnosed medical problems today, and if left untreated, it can attack your joints, heart, nervous system. Yet what I'm talking about is not some mystery illness. Would you be surprised to know it's Lyme disease? I know, I've done the research because I'm living through it. Tonight we begin an in-depth look into the Lyme controversy.
I've been misdiagnosed as having chronic fatigue syndrome, lupus,
MS, fibromyalgia,
lupus, fibromyalgia, MS,
chronic fatigue syndrome, fibromyalgia.
These are real people featured in an upcoming documentary by Open Eye Pictures. They're a few of the countless true stories of suffering, misdiagnosis, and a seemingly futile search for answers.
I had a doctor at UVA tell me it was all in my head and that I probably needed to see a psychiatrist.
Michelle Spruce is among them.
We were camping and hiking in Smoky Mountains.
About 12 years ago, she got a bite. She had the classic bullseye pattern, and still no one thought of Lyme disease.
And we went to the doctor, and she said I got bit by a spider. Even though I had the rings, I had the fever, I had the flu.
Honestly, Michelle didn't think of it either, but she began getting extreme pain, swollen limbs, disrupted sleep, constant fatigue. Doctors put her on a variety of medications, but keeping up her job at the Lynchburg Community Market became increasingly difficult.
I went to urologists, neurologists, everything, and no one did a Lyme disease blood workup.
About 2 years in, a doctor her mother worked with in West Virginia recognized the symptoms, saw Michelle, took her off all the other drugs, and put her on antibiotics.
And within 6 months, I was back to work full-time and back to being Michelle.
But after having waited 2 years for proper treatment, Michelle, like countless others, has had many setbacks and is now out of work on disability.
I've been in business 42 years doing this. This is easily the toughest disease I've ever seen to diagnose or to treat.
Dr. Norton Fishman practices in Rockville, Maryland. He became what's known as a Lyme-literate medical doctor after learning some patients he'd misdiagnosed had gone to a doctor in New York and were treated for Lyme, and they were getting better.
I started looking into it, started doing testing, started then following up with treatment from what other doctors were doing, and I found that 80% of my people I was calling chronic fatigue, fibromyalgia, was induced by Lyme disease.
They used to say that syphilis was the great masquerader because it would present in so many different ways. It could present with seizures, it could present with dementia, present with heart disease, and it was all syphilis. And this is the same way.
That's why Lyme disease is so hard to diagnose. That and the fact that you don't always see the warning signs.
You don't have to have the tick bite, you don't have to have the rash. Everyone agrees with that.
The current tests are also unreliable. That's why the CDC says doctors shouldn't base a diagnosis on them. Instead, do some detective work. But Dr. Fishman says not enough doctors are listening.
So you think that there are many cases of this chronic Lyme out there that people aren't aware of?
Absolutely. In fact, when we look at the
thousands?
Well, let's try millions.
Okay, so now some of you might be wondering, what do I do? We have set up a special section on our website for this report, including a checklist to take to your doctor to help with a diagnosis. As you've just heard, it can be a long road to discovery. Tomorrow, how my sister's story kept me from traveling down it too far.